My name's Helen. I'm a fourth year nursing student. This is my story. I was working with Nurse Dunphy, my preceptor, who's been a nurse at the emergency department for 15 years now.
It's a Friday night and the ER department was chaotic. An elderly woman was triaged into a bed in Helen's assigned area. The client was unkept, her ER admission record stated she had no fixed abode, and her body odor was strong and unpleasant. The ambulance crew said that they had witnessed her having a seizure while laying in the doorway of a Royal Bank. She was tachypneic with an O2 stat at 89%. She did not respond to voice or painful stimuli. She was also hypertensive, tachycardic, and afebrile. Her capillary blood glucose was 4.3, and there was blood on the pillow, and she was bleeding heavily from a wound on her scalp. Helen was about to check the patient's Glasgow Coma Scale when Nurse Dunphy came over to the bed.
Hello? No? She's still unresponsive. Oh,
Where am I?
hey! Oh, that's it! We're finished here, Helen!
You need to go take care of a real patient.
I accepted that patient and I need to go and assess them.
You want to be an ER nurse? You need to learn to get your priorities straight, Missy. You need to learn to triage your time, too. Go and care for the man with chest pain over there.
Helen approached the patient in the next bed with chest pain and determined that he was clinically stable. The physician had diagnosed that the patient's chest pain was related to severe gastric reflux and was planning to discharge him. Helen returns to the nursing station.
Helen, go do these vital signs on these patients.
The elderly woman whose initial assessment Helen was trying to complete was not amongst them.
Woof! What is that stench in here? Glad to get rid of that smell.
I'm just gonna get a set of vitals off of you, if that's okay.
Oh, that's enough, Helen. You should go on break now.
Helen was perplexed that no vital signs had been taken in over an hour and her GCS had not been checked. She was also stressed that this woman had had a seizure and had signs of a head injury that may have occurred before or during her seizure. She was now conscious but not fully alert, and no vital signs had been done. She had barely spoken since her admission and no history had been taken from her. Her ER chart now also read past medical history, alcohol abuse.
She does not need to take up a bed. That is what she's after. She is a huge cost to the system. On your way to break, wheel her around the corner.
I think I should...
No. You don't follow directions very well, do you? There's a vast difference between thinking and knowing.
Helen knew that around the corner meant that the patient was out of sight from the ER staff and it would be at least an hour before she was seen by a physician. Nurse Dunphy had put staples in the patient's head and now she was being pushed towards the exit. It was 5 a.m. and the buses did not start running until 6 a.m. She had no cash on her for bus fare. She did not look medically stable. She was also still unsteady on her feet. It was fall and very cold outside. Helen was concerned that she was being discharged in this state.
Are you okay?
No. She's fine.
Let's bring her inside until the buses start running.
No. She's been discharged.
But we can get her a pair of pants and a jacket from the psychiatric unit, look into a bus pass. Have you looked to see if there's any space in shelters?
Come with me. You are not a social worker, and you need to learn to stem that bleeding heart of yours.